What's up, everyone? I want to go ahead and answer a few questions that we've gotten throughout this week from some of our patients and then also some people on the internet as well. And I just want to go ahead and jump into some of these right now. The first question that I got is, does chiropractic adjustments hurt? It's a great question, actually, and sometimes the better question is chiropractic safe? And the answer is yes, it is safe. And the question, does chiropractic adjustments hurt? And to be honest, the answer sometimes is sometimes. And so the reason being is this, is that when we do an adjustment of the spine, a lot of times there's a lot of inflammation that comes with the injury of the joint. And so when we want to go about and correct the joint position, the misalignment, there is some swelling that does kind of cause more pressure and temporarily can create a little bit of discomfort with the adjustment. Now, it shouldn't really hurt. There can be some discomfort, but it shouldn't cause any pain. And so when we go in and get that joint to shift back into position, we have to go through that inflammation and correct that joint into the proper alignment. And through that, now the healing process can actually take place, where we can get pressure off of the joint and then get pressure off of the nerve, allowing your body to function and heal properly. Now, is chiropractic safe? Now, that's a great question. Especially within our technique, chiropractic is extremely safe. And the reason why is most people wonder, can chiropractic cause like stroke or can cause major injuries? And the chances of that actually happening statistically is like 1 in a million. It's very, very small in terms of the chance of that actually happening. In fact, it's more likely that you're probably walking into an office because you're actually currently in the process of having a stroke. And the adjustment doesn't really cause it, but it is something that has happened in the past with chiropractic offices. Now, what I can say in terms of our office and our adjustment technique, especially when it comes to the chances of stroke, our technique is very, very safe and it's very, very effective. Now, when it comes to the vertebral arteries, now you have an artery that goes from the brain into the skull, and it goes down into the foramens where the vertebral artery goes into. Now, what happens is a lot of concern comes with that, because when you go to a traditional type of chiropractic office, they'll take that spine and then they'll rotate and twist and crank on that neck. It puts a lot of strain onto that joint, but we don't actually do that in the office, because the goal for this is to get the joints in the back, which are called facets, to move. And that's why you hear a lot of the popping, clicking, and cracking. A lot of times it's not just one joint, but when you get that joint into that end range of motion, you're gonna get a lot of joints to crack, snap, and pop. We don't want that to happen. Instead, what we want to try to do is maintain your spine into as neutral of a position as possible. And instead of rotating the joint into the spine, we want to just laterally flex that joint, because our target is more of the disc, not the joints in the back. So when I adjust that spine, I'm eliminating as much rotation as possible and just shifting that joint back on top of the disc to alleviate the pressure off of that nerve. So we're not doing any type of stress to the vertebral artery. We want to maintain that integrity as much as possible, so that when we do that adjustment, we know it's very safe, but we also know it's very effective as well. And so that actually leads me to the second question, is what is the difference between your chiropractic technique compared to the other techniques around? That's actually a great question. I kind of talked about it already, but the major reason that our technique is very different is, one, the analysis, and then two, the actual adjustment in itself. Now, when someone comes into our office, we don't just lay someone on the table and just like, hey, where's your pain at? And then start cracking a bunch of stuff up and down the spine. Instead, we want to take our time to investigate the spine, ask specific questions to get a solid history about what's going on, what type of injuries have they've had, and then we break the analysis into 5 different components, kind of more like 6, but 5 really are the major ones. The first is visualization. That's why we gown patients in our office, because we want to see the spine in its entirety. We might see that there's a winged scapula on the shoulder blade. Maybe someone has a bit of a curvature in their spine, maybe some hypertrophy or tense muscles, maybe an uneven shoulder or a kinked head over to the side. So we're visualizing the patient because we want to know exactly what's going on with that patient from an outside perspective. The second thing that we want to do is what's called instrumentation. What we do is we have a technology in our office. The one that I use specifically is called a delta T, but we want to measure for the inflammation of the spine. And again, we have patients in a gown because we're going to scan the patient's back. Both sides of the spine should be relatively the same temperature. However, when there's a joint that's injured, it gets inflamed, it gets irritated, more heat's going to radiate on one side more than the other. And so we're going to have a characteristic spike in the needle of that instrument, and it's going to help us to know where there's a potential area that's injured or misaligned, or what we call a subluxation, causing irritation onto that nerve. And now the next thing that we want to do is motion palpate. Now there's 2 different types of motion palpation. The one is going to be One is going to be static palpation, and then the other is going to be global motion palpation. Now, static palpation is essentially where we're kind of feeling for the edema of the spine. When you get an injured joint, you're going to get swelling that comes with that. And you're going to start to feel a little bit more of a bogginess, almost like a swelling type of area. As opposed to like the tissue being nice and toned, you're going to feel a little bit more of a bogginess in that specific area. When we push into that area, oftentimes there's going to be coinciding tenderness or pain with that. And so when the videos that you might watch from us, you might see me push into the spine and saying, does this one hurt? Does that one hurt? It's because we're looking for specific points of pain or tenderness. Now, the other motion palpation is essentially where we're actually moving that joint back and forth, trying to feel for the proper movement of that joint. Part of the subluxation or the misalignment of the joint is when it shifts out of position, it won't move the way it's supposed to. And so joints above it might be hypermobile, so it'll be moving too much, but then that joint, when you get onto that specific area and you're trying to move that joint, it's going to feel really fixated. It's not going to move the way it's supposed to. And that's another indication that that's most likely an area of a subluxation or misalignment that we need to correct. Now, the other thing that we want to do is also radiographs or x-rays. We do x-rays in our office because, one, I want to know exactly what's going on underneath the skin. We don't want to guess on our patient's spine. Sometimes I've had patients where they have some pretty significant scoliosis or curvatures, and you can't really tell the severity of that scoliosis or the curvatures or any of the issues that's going on within the spine from the outside. You also want to know the health of the spine, whether there's some degeneration, maybe some bone spurs are developing, because you don't want to adjust an area of the spine and it's not really able to move, because if it's fused or fixated, I don't want to break through some of those areas that are actually fused. We want to make sure we leave those joints alone and actually work on the other ones around that. Because I want to make sure that when we go to adjust someone, again, we want to make sure it's very, very safe, but also it's very effective. So when I actually go to correct it, I can see from the x-rays how that joint's have shifted out of position. So when I go to correct it, I want to push that joint back into position the way it needs to be in that specific direction. And then the last thing is going to be the history of the patient. Now, that is actually the first thing that we start off is the history, because we want to know exactly what kind of symptoms they're coming in with. Some patients might have sciatica, but when they say sciatica, it just might be going to the hip. It doesn't always go down into the legs. That's not true sciatica, but it's going to help us to have an indication on where that problem is actually going to be coming from. Sometimes patients come in with headaches. Sometimes they'll wake up with the headaches, which is kind of leading me to an area in the spine, more so in the upper neck, where sometimes they might have those headaches throughout the rest of the day. It doesn't happen until like the afternoon or the evening, and oftentimes those are more like tension headaches, something that's coming from the lower part of the neck or maybe the upper back. So we're asking specific questions because we want to know exactly what they're experiencing, and it also helps us to understand a little bit more about where those problems might be stemming from. Now, the next question that we got was, how long do treatments last? Now, that's a good question, and to be honest, I don't know. It's going to be dependent on the specific individual. Some patients, they can get some really great results within a short period of time. Some people, it takes a lot longer, depending on especially what their goals are. Now, in our office, what we tend to specialize in is people that experience more chronic pain. If someone's just like, man, I woke up with this neck pain yesterday and I'm really having some severe pain, I just want to get out of pain, well, we can usually get those people some relief pretty quickly. I mean, it could take maybe a couple weeks. Some people maybe a little bit longer, maybe a few weeks. But usually when people come into our office, it's because they've been dealing with pain for months to many years. I have patients who have been dealing with back pain for 10 to 20 years. And so throughout that time, your body's developed a lot of habits. It's developed shortened muscles, weak muscles, the ligaments are becoming shortened and tightened. There might be more arthritis and degeneration that's involved with that. So those patients are going to take much longer. Now, what we have found in our office is that within the first few weeks, we can get pretty significant results, up to 55% of total improvement of their symptoms. Now, what that means is essentially, there's some patients that have gotten way better, like almost completely better, and then there's some people who've gotten a little bit less. Again, depends on what's going on in their body. What we have found is after about 4 months, usually we can get people to about 70 to 75% of improvement of their symptoms. Now, again, there's some people that we've gotten complete resolution of their symptoms, and then there's some people who are just like, man, like I'm really still struggling. It's because their problem's been there for many years, and so that person might take up to 6 months, 12 months for us to complete their treatment to really get them the relief that they're looking for. And so everyone's different, and this is why we don't put anyone, in a bubble. We want to make sure that we give that patient the specific recommendations that they need, and we want to look at what's going on. We want to see what's going on with the health of the spine through the x-rays and see what's going on with their symptoms, because we want to get as much information as possible so we can give you the best recommendations according to your spine and your health. And then the last question is, how do I maintain my results? How do I maintain the best results? That's actually a pretty good question, because a lot of times patients, they come into our office and, you know, they think, okay, doc, you're just going to fix me and I'm going to be better for the rest of my life. Unfortunately, that's not true. A lot of times, you know, we have injuries. We put stress onto our body. Maybe you're sitting at a computer or at a desk for, you know, many, many hours a day, and you're putting more strain onto your neck. You're putting more strain onto your mid-back. Maybe you're at a job that you're lifting pretty heavy. You know, you're going back, lifting some boxes, turning and twisting, but unfortunately that's going to create more stress onto your body. You know, so we do recommend a form of maintenance in terms of our office. You know, that looks different from everyone. Some people come in once a week, some people come in once a month. It just depends on what we see when we get there. But the other thing that I always tell patients, it really does come down to, one, is your habits, and then two, exercise. We want to make sure that we're strengthening the muscles around the spine to create as much stability and support around your spine. And then also, sometimes we develop these short and tight muscles over the years. We got to really reverse some of that by giving some stretches that patients need to do to maintain throughout their life. The other thing is your habits. You know, we talked about, you know, some of the stresses that you put on your spine, whether it be at you're at a computer. Maybe you're looking at a laptop quite regularly. If you're looking at a laptop, you're bringing your head down, your head's going this way, it's going to put a lot of strain on your joints. Maybe it's you sit on a wallet. If you sit on a wallet, some patients, I've had these patients who sat on like these 2 to 3 inch wallets, and it's just crazy. I'm like, how much money do you have in your wallet? And many times it's just credit cards, and many times it's just paper and receipts. You know, I don't even know why they carry that stuff. But at the end of the day, it's just putting more pressure on your hips. If you sit on that thing for a long period of time, it's going to push your pelvis up, it's going to put strain on your lower back, and it's going to cause these back issues to happen. You know, one of the things that we see many times, especially in the reception area, you know, when patients come into our office, you know, when you're waiting for your appointment or you're just waiting for somewhere in line, what do we tend to do? We pull out our cell phone, we watch some videos, we read some articles on our cell phone. And when that happens, people look down at their cell phone, puts more strain on their neck, puts strain onto their mid-back. Now, the reason why that's important is they've actually found that for every inch your head shifts forward, it adds about 10 to 12 pounds of additional stress onto your spine. And so that's a lot of stress. So if you're in that position for a prolonged period of time, you're going to put more strain onto your joints. So in order to maintain the integrity of your spine, and also just to reduce for future stresses as well, you want to improve or correct your bad habits. And so we try to educate our patients as much as possible, whether it be through workshops, whether it be through worksheets, whether it be through one-on-one instruction on exercises and stretches. We want to get the best results, not just for the short term, but we want to get the best results long term as well. And that's it. I really do hope you guys found some benefit from some of these questions that patients have asked and other people online. If you guys have any questions specifically as well, please leave your comments and questions below. We'd love to answer those questions in the future. But I want to say thank you for even watching. If you like this video, please click that like button. Subscribe to our channel to watch more videos just like this. But otherwise, thank you so much for watching. Have a great day. God bless. Peace.